Hi everyone. Today I'm going to discuss that is about a dengue. So dengue, we have to know what is this. Dengue, that is a viral infections transmitted primarily by the Aedes mosquito. Okay, by the bite of the mosquito, and also this dengue is known as breakbone fever. The other name of dengue is known as breakbone breakbone fever. So this breakbone fever is a mosquito-borne viral infections. Okay, by the bite of the mosquito that can affect millions worldwide. Next, we'll see the definitions of a dengue. The definitions of dengue. Uh, we'll see now. So the definitions of dengue. The dengue is an acute viral illness characterized by high fever, severe headache, pain behind the eye, joint and muscle pain, and rash. Okay, so when dengue is before also I told you that dengue is a viral infectious disease, that is uh, viral infection disease characterized by high fever, severe headache will be there, pain behind the eyes, joint and muscle pains, and rash will be there. Okay, next we'll see the causes or etiology. The causes, main causative agent is here dengue virus, that is DENB, dengue virus, transmitted through the bite of an infected Aedes mosquito. Okay, and next causes, that is Aedes mosquito, primary vector of dengue virus. So next we'll see the risk factor of dengue. The risk factor of dengue, that is a geographic locations, living in or traveling to endemic areas. Next we'll see the seasonal factors. So seasonal factor, and next is a age, previous infections. So these are the risk factor of the dengue. Next we'll see the sign and symptoms. What will be the sign and symptoms or clinical manifestations of dengue? So basically in the sign and symptoms of dengue, it will be high fever. Okay, more than 100 up to 104 degree Fahrenheit in Celsius. It will be the more than the normal temperatures, up to 40 degrees Celsius. Next, a severe headache will be there, pain will be there behind the eyes, behind the eyes pain will be there, and joint and muscle pain will be there. Okay, nausea and vomitings will be there, fatigue and weakness will be there, skin rashes will be there. It will appear 3 to 4 days after the uh, fever onset. And next, mild bleeding will be there, like a nosebleed, gum bleed. Okay, next we'll see that is about a diagnostic evaluation. So in diagnostic evaluations here, clinical evaluation is required, like next is laboratory test like dengue NS1 antigen test is required. Okay, and next is what a complete blood count CBC is required. Okay, so these are the tests we have to perform. So next we'll see the medical management. So in medical management, supportive care it's required, antiviral medications. So antiviral medications such as like acyclovir medications, and next pain is there, so we will provide a pain relief medications such as like acetaminophen is recommended, and NSAIDs. So do you know what is the meaning of NSAIDs? That is a non-steroid anti-inflammatory drugs. Examples such as ibuprofen, it will avoid due to a bleeding risks. And next is monitorings. Okay, so these are the medical management. Next we'll move on nursing management. So in nursing management here, assessment, so regular monitoring of temperatures, hydrations, status, sign of the bleeding. Okay, and educations is required, supportive care, preventions. So preventions, so in preventions, educating on mosquito control and personal protective measures. So we have to educate uh, on how we'll control the how we'll control and personal protective measures. Example like refillent clothings. Next will the complications. So complications of this dengue, that is dengue hemorrhage fever, dengue shock syndromes. The next is organ impairment. So these are the complications of a dengue.